Welcome everyone to the Oral Health LIN meeting of the North Sound, and we're just really so pleased to have you here today to just be thought partners in this and advocates, as you already are, for oral health in the communities that you serve. And we're just really excited to see what comes of future plans for the oral health work that's in this region, and to share with you some of the developments that we've been working on, and just to begin to craft together a direction, as we do periodically with the LIN, of just, where is our most salient work happening, and how can we support that, and how can we move forward in partnership to create great outcomes in this field. So I just welcome you all. I just want to begin by acknowledging that this month, November, is Native American Heritage Month. And I've been reflecting on something I saw that our CEO here at North Sound ACH, Liz Baxter, had written. And she said, tribal sovereignty is one of our grounding frameworks, not additive, but intertwined. And I think that is, such a beautiful statement. We work with several frameworks here at North Sound, but it is absolutely true that that tribal wisdom, place-based wisdom, and intergenerational wisdom, we try to lean into that and live up to that in every way we can. And so I'll begin with our land acknowledgement here at North Sound, which is that we begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. I invite you today to just introduce yourself in chat, and just your name and your organization, and so we can begin to know who is in the room with us. Of course, we recognize all the faces really, but we may not all know each other. So just invite you to add your name to the chat. This meeting is being recorded and will be uploaded to the resource library. We have a new page in our resource library that is specifically for oral health. And so we'll be sending that out to folks who couldn't attend today, so they have access to that same information. And with that, I'd like to transition to our Director of Innovation, Nika Osteen, who is going to provide some information about communities of practice and other information.
Yeah, good to see everybody. Thanks for getting us started, Keiko. We're really hoping most of this meeting is going to be kind of a working meeting to talk about the future of the LIN and where we're headed. But wanted to give you all just kind of some really brief updates about where North Sound is headed with the LIN, and talk about what a community of practice is. So we talked about this at the meeting on September 30th. I know some of you were able to be there, but not everybody. It was really lovely to be in person. Hopefully we can do more of that in the future. But part of what we shared there is that our CORA is winding down their funding for the oral health LIN this year. And so next year we are moving to be a community of practice under the North Sound ACH Collaborative Action Network, which is really not that different from what we have been doing as a LIN. It's kind of mostly entitled that the change is going to be taking place. The purpose of a community of practice, and Natalie is going to go ahead and put the link to our community of practice page in there for you, is to bring together a group of people who want to work towards the same goal, have, experience, knowledge, backgrounds, professions that are necessary to move the meter kind of on different problems or issues in the area. The goal really is to bring in the people that know what's going on and know what needs to happen to make a difference, and then really focus on collaboration and collaborative projects. So like I said, it's not really that different from what we have been doing together already. We just want to be really intentional about the collaborative part of it and making sure that you all, as the experts in oral health in the North Sound region, are the folks who are moving this work forward and bringing the ideas. Um, we are going to be um, looking for someone to help lead that work in the new year. So we have done this with a couple of our other communities of practice, having a co-lead who helps the ACH. So us as the ACH will still continue to be the convener, bring folks together, help with, facilitation, agenda creation, however we can help move that work forward. That is a role we will still continue to play, but we also want to make sure that someone from the community who is involved in this is helping us lead that work forward. Um, as we're not the content experts in this, but we are all here because we all have the same passion for it. So that will be part of the kind of first steps as we move this forward in the new year. And we already lead several communities of practice. If you are able to go to that page on the resource library, you'll see some of the ones. And we've been doing this for about the last year, a little over a year. Jail reintegration is one of the first ones that we launched. And we have two co-leads who have lived experience with incarceration that help lead that work. And that's been a really successful community, bringing together people from across the region. We also have the Measurable Equitable Wellbeing Community of Practice, which some of you might have been involved with. That is led by Matt Main on our team with help from community initiatives. And you might have seen in our most recent newsletter, just launched the Wellbeing Survey pilot. So they have done a lot of really cool work together that is kind of coming to fruition right now. And then Cynthia is here, and she has been leading the DEIB professionals community of practice for the last year. So that is bringing together folks who, in their professional role, have some sort of DEIB title or lead that work at their organization. So she's been very involved from the beginning in helping us kind of get this community of practice model up and going, as has Tessa, who is also on the call with the jail reintegration community of practice. But I do want to invite Cynthia to just share a little bit about her experience. And then if anybody has any questions about this shift, I'm happy to answer those.
Hello, everyone. My name is Cynthia Andrews. I think I know some of the folks in the room. I am the Innovation Initiatives Program Manager here at the North Sound ACH, and I have been leading and working with the Diversity, Equity, Inclusion, and Belonging Practitioner Community of Practice, of which I'm formerly a practitioner myself. So it's been an experience because we have been working with a couple of different groups, but it really does give you the opportunity to be in community with folks who have the same topic. Oftentimes we go to sessions and there's so many folks that are doing all this other work, but having a community of practice where you're focused on just one important topic that you can start to really dive into some conversations, help support each other as for us as practitioners or those who lead that work, and then look at some of the policies that we may be facing. And I know in our community of practice, it's going to be, we're about to ramp up because of some of the pushback with the DEI work. And so it gives us a platform, gives us a community that we can be honest, build a relationship, and then put the work that we're doing forward to really hopefully make a difference. We can go in lots of different ways. We've met a couple of times in person, and we're working to have one more session in person before the year is over. But it is a great way to build closer relationships and to be more focused on the topic that you're working on, and very much very intentional about that work. So we've had we started and we stopped, we started, we stopped, but we have not stopped all the way. We're continuing and moving forward. And I think that it gives us more momentum because we are so focused. I'm sorry. I'm going to back up and say we didn't stop. We redesigned because it looks different. It started to look different. So we redesigned. We didn't necessarily stop. But yeah, I just want you to encourage you to be part, make sure that you are connected and be part of the community of practice. I think you'll see a lot of similarities in what you've already had, but I think more of a cohesive group, easier way to build relationships and to have a stronger voice. It's great with shared decision making, but also having that stronger community voice is important. So I encourage you to continue the movement and enjoy the journey. I think that's all I have.
Thanks, Cynthia. I would say the only thing I missed is, if I think most of you have probably already like heard about the Collaborative Action Network and have been involved in it. Um, that is kind of our umbrella that we bring folks together at North Sound ACH. And if you haven't yet, please reach out to Keiko, and she can get you started with that. And all of that information is also on our website. There is a tab for Collaborative Action Network. So if that's brand new to you, reach out. And if anybody has any questions about this shift, please feel free to ask them. And otherwise, I will pass it back to Keiko. Or am I passing it to Laura? Hold on. I might be passing it to Laura. Oh, I'm passing it to myself. Any questions before I do that? All right. Well, keep tuned. The one thing I will say is our upcoming January convening, we're hoping to have some in-person space for the communities of practice. So hopefully in January, that'll be our next time to be together in person and keep moving this work forward. All right, so before we pass it over to Keiko to do some of the actual like digging in and work, Laura and I are going to just really briefly share some updates from some work we've been doing recently. So last month, Laura and Lynette on deck, who is not here today, but who has been our committee chair for the oral health LIN for the last, since the beginning, really, mostly, we're able to go spend, was it 3 days with our Cora in CTEC, and it was lovely. And I'm so thankful to Matt, I see you're here, the folks from our Cora who invited us there. And we did a bunch of reflection over the last 5 years of the LIN. And it was really powerful and impactful to see everything kind of brought together. And I know that their evaluators are working on putting together kind of a case study of the different LINs. So hopefully we'll get to share that out all with you in the next few months. But it was really lovely. We were there with the other LINs, so Spokane and oh boy, I am blanking, Pierce County. There we go. And yeah, it was great. But the kind of last day of the meeting, the Learning Collaborative, we spent discussing the priorities for 2025. So I just wanted to be transparent with that conversation that was had, because that will kind of lead us into our conversation and our planning a little later. But just for you all to start thinking about your priorities for the oral health work in the North Sound in 2025. Kind of the three main things that arose from our mapping out of the last 5 years and thinking about what's working and wasn't working, were three priority areas, including mobile access, which has, as you all know, been a huge area of work for this group. I saw someone is here from Dental, which is doing some really incredible mobile work. Advocacy was the other one. I know Lynette and some other folks were really involved in doing advocacy around keeping water fluoridation in Linden. And we know that that is an ongoing conversation in Linden, and just advocacy around dental therapists was also an area that many of you were probably involved in. So continuing to do that sort of advocacy. And then the final one is workforce, which came up across all the LINs again and again and again. Like there's just so much struggle finding folks, dental assistants, dental hygienists to do this work. And with the expansion of dental therapists, there's a lot of opportunity there to do some more workforce enhancements. So those were kind of the three big areas that came up for us. And then I wanted to give Laura an opportunity to share about kind of the data that also went into those conversations and went into our meeting on the 30th before we kind of dive in. So Laura, do you want to share?
Yeah. Hi, everyone. I know some of you here today were at the in-person LIN meeting on September 30th, and were walking around the physical room looking at maps that had different data indicators. But for those who weren't there, I just wanted to give a little bit of an update and a sneak peek. It's not really a sneak peek because it's not a preview, but a little peek at one of the maps as an illustration. So our goal with this project was to look at a number of different health, oral health indicators that would tell us what's happening and where the greatest needs are in oral health. And where we could, we looked at the data on a sub-county level, so something smaller than a county size. This is an example of a map that was developed based on school districts. This is a map of what % of elementary schools within a school district have a school-based sealant provider. So you can see that most of Whatcom County has it. The maps will be, the link to all of the maps will be shared in the chat in 2 seconds, probably like right now. They're all on the North Sound ACH's learning library. So they're all there. Yep, that's what it looks like. So in this map, what you see is all those white spaces are school districts where no elementary schools have a school-based sealant provider. And then the in between blues, so not the dark blue, but not the white, there's some percentage of some lower percentage of elementary schools in a school district that have providers. So this is just an example of a way we can look at data in a geographic way to help think about where geographically, physically, where there's gaps, where the greatest needs might be, and where there's opportunities to expand and make a difference. Some of the other indicators were things like what percentage of kids with Medicaid are getting annual dental visits, what % of adults, which communities have water, fluoridated community drinking water, the number of providers, dental providers and clinics in the various communities, those kinds of things. So take a peek at the whole map, the whole set of maps. And if there is an entity that wasn't able to have somebody at the in-person meeting, but is interested in having their group or maybe their staff look at these maps, I am available for a limited number of convenings, or it could be, we could probably figure out how to do it by Zoom, or we could do it in person. So if you work with an oral health coalition or some other kind of group for whom this would be valuable information, reach out to me. I'll put my email in the chat, and I'd be willing to come to your group to do kind of a mini data walk, sort of a smaller version than we did on the 30th. So I guess the last thing I would say is that regardless of the name of this collaborative work around oral health, whether it's a LIN or a community of practice, I sort of see that as just like the shape and the form of the container that holds the work. And I hope that this data and these maps will help guide what the participants, all of us, all of you, decide to prioritize and work at together based on where those needs are, and of course where the resources are available as well. So happy to answer any questions. Or hear comments if there are people who were at the September meeting who have anything they'd like to chime in with.
Yeah, Laura, I was just going to uplift that. I see at least a few names here of folks who were at that meeting, and it was just so impactful. And just wonder if there are any observations from that meeting that anyone would like to share, or just, revelations that came from some of those deeper dives into the data. Just love to hear from you if you have any thoughts about that.
I will also say that I did hear some people at the meeting say, this really doesn't tell us anything new. It tells us more detail on what we already know to be the key issues. So in that sense, it may not have been like this amazing aha for everyone. But I do hope it can continue to be a very specific tool for helping with program planning and other decisions.
I had a question, if that's okay. Hi, everybody. I'm Glenn Puckett. I'm with WDS. Laura, I guess my question would be, and first, let me just thank you for doing all this amazing work with the data. It's really fun to pore over these maps and look at these files. I guess my question is, in terms of the process of putting all that together, how scalable or replicable is the analysis you did in terms of, trying to get other ACHs to do something similar? Because for those of us who have kind of a statewide perspective, I look at what you've done in North Sound, and I just wish that other regions had done the same thing, because then we'd have a really complete picture, which is really useful when you're thinking about workforce planning and kind of big picture policy changes. So just wondering if you could speak to that of, was there a lot of art and less science and just rolling up the sleeves? Is this a replicable process that you use? And what are your comments on that?
Yeah. I think it would be replicable, but not without some work. There are some things that are readily available on other people's websites, like the number of providers. That's easy. You just go to it. Alia, who's on the call, was key in getting zip code level data from the healthcare authority. So that data, unless you know another process, Alia, would need to be through her. So it would be a bigger ask for the healthcare authority, and she might be able to speak to how doable that would be. The only data that I myself really compiled was the sealant provider data. And in this area, there's really 3 main sealant providers. And so they were willing and able to provide what schools they were in. And then I got the denominator data from the OSPI website. So there was some compilation and cross-referencing with that, and absolutely relied on the willingness of those partners to share that information. So I guess I would say there's some things that are really low-hanging fruit and easy, other things that have some extra steps and are a special request to the healthcare authority. And then other things, the sealant thing in particular, that relies on the cooperation, collaboration of the sealant partners.
Thank you, Laura. I figured that was the case with the sealant one. That's the one that I think is most challenging.
Yeah, I will. And just a acknowledgement to the sealant providers in the North Sound area, Unity Care Northwest, Best Dental Help, and Community Health Centers of Snohomish in partnership with San Juan County. They were just all so willing and like, here's our list and these are the schools, and just so willing to share the data. So super kudos to them for that.
Absolutely.
Does anyone else have any other questions for Laura that we can uplift at this time? Or any lingering questions about communities of practice, something that hasn't been covered yet? Okay. Well, what we'd like to do now is just based on that list that came from our Cora's LIN convening about priorities, potential priorities going forward into 2025, and that is in mobile dental, in advocacy and workforce, is just really kind of dive into that a little bit more about what that means to you or opportunities you see. We're going to be using Padlet, which some of you may already use. It may be new to some of you. It's a note-taking app. It's really easy to use, and Natalie's going to put the link in the chat right now so you can be able to access the Padlet that's set up. What I'd love to know is just by kind of a thumbs up, or whether that's virtual or your actual thumb, just making sure that everybody can see that and has access to the Padlet platform that's set up. Okay, seeing some thumbs up. Hoping everybody can see that. I'm going to wait just a minute more and make sure that everyone can get onto that. Natalie is going to share screen so that those of you who, I think I saw, Leslie, you're driving. Well, this actually won't help you, Leslie. I'm so sorry. But if anybody is using their phone, you'll be able to just see it a little bit better. So basically, the way that Padlet works is that you'll see in the lower right-hand corner, there's a plus sign. And if you click on that, you're going to be able to create a post. And once you have created that post, I'm just going to do a test one here right now. Once I've created this post, I'm able to drag that comment, whatever that comment is, to whatever column of, just kind of overall topic that I'm referring to. And also, once someone has put in a post, you're able to kind of upvote that just by this little thumbs up icon right here. So that we'll be able to get a sense of who is kind of signing on or co-signing a particular idea or thought, and we can kind of start to hone in on what kind of the overall sense of what this group is thinking today. So I am going to delete this, but just invite you to add on whatever your comments are. And it looks like it might be just assigning kind of random monikers to you all. So if you also feel like it's important to identify who you are, you can just add that to your post as well. So we'll probably give this maybe 10 or so minutes. We're a little bit ahead of schedule, so if we need to give more time to it, we will. And let's see, Ashley, you had a question in here. You can add on, yeah, if these three buckets don't, well, two answers to your question. If these three buckets don't contain what you feel is a priority moving forward for oral health in this region, there is this other column to the right where you can add your thoughts to that. If you're already working to some degree in any of these areas, you can kind of update everyone so that we all kind of have shared knowledge about what's already happening in the region. Okay, fantastic. Well, thank you so much. And just kind of, want to, some of these ideas are, they just kind of describe a world of magic. And I don't mean that in a negative way, but in a promising and enlightened way. So just really grateful to you all for sharing fully. It sounds like, as Nika mentioned, lots of energy for mobile dental. What we'll do after this meeting, our staff is just kind of gather together these thoughts and put them together in a kind of a more organized fashion. And as Glenn pointed out, there's some that are close to each other but have some nuances in the thought that they're expressing, or the initiative that they're expressing. And so we'll take care of all of that to be able to present all that to you. And that will be part of our promise to you for upcoming correspondence. And then as we kind of move toward a closing, I just want to again take some time for any questions anyone has or comments that they'd like to add at this time.
I'm noticing, this is Laura, hi. I'm noticing the similarities between what was just generated in the Padlet and the kind of 5 anchor strategy graphic that the LIN has used in the past, with access to care across the top and then 3 main strategies underneath that. And I guess what I'm wondering is there a sense that may continue to be the framework that describes the work and we kind of put these ideas into that? Or is there a thought about trying to focus in more and remove some of the strategies, one or more of the strategies that have been considered in the past? And maybe you don't know the answer. I guess I'm just putting out the question to everyone.
Yeah, I'm looking for Nika on this call.
I'm up here.
Are you here? Okay. Somehow I'm not seeing you and probably looking right at you. Nika, I don't know if you have any thoughts about that, of those LIN anchor strategies that have been focused on.
I think that part of the work of this group will be to drive where there is energy and where there's interest. And that might align with some of those anchor strategies. It might not. I think, what we're seeing here is, I mean, there's a ton of comments under workforce. There's a ton of comments under mobile access. So there's definitely, and I mean, there's under other two as well, but really that is where there's a lot of comments. So it seems like there's a lot of energy there. And that's what we're really hoping this group can bring. Is we know that that is where folks are seeing the need. So what are the ideas that we can collaborate on? What can we do together? And how can we at the ACH support you in kind of dreaming and creating those projects and ideas? So I don't know if that really answers your question, but I mean, the goal is that this group will answer that question with how we move forward. And I had a question for whoever Serious Jaguar was. The advocacy for dental deserts. I wasn't sure if there was a specific kind of are like advocating for increasing. I'm not sure what the advocacy thought is behind that, and I was wondering if whoever put that in there could expand. Well, if you want to private message me,
We can private message. Yes, absolutely. And perhaps Natalie, you can also include Nika's email in the chat for everybody as well. I did want to bring up, before we move towards some closing thoughts, somebody had asked about funding opportunities for mobile dental services in the North Sound. And so I'll just mention briefly, we will open up our next round of partner proposal the partner proposals. It looks like, and Cynthia, perhaps you can confirm, I believe in January, and that is something that is part of the Collaborative Action Network partnership. And so it's just open to partners of the network. If you aren't sure if you're a partner or if you would like to be a partner, just reach out to me. I'd love to tell you about it. The funding is really the least of the resources and benefits that come from partnership within the network. So if you're a longtime partner, but you may not know all of the resources that we offer to support the network, also love to talk to you about that and just make sure you're really well informed about all of the ways that we support our network partners, and then just broadly our communities as well. So feel free to reach out to me about that. And just also wanted to give a shout out to our January convening, which is coming up. That's our in-person events that we hold twice a year, bringing together as many of our partners as possible for a day or two. I think it's 2 days, actually, for January, of just deep learning and connection and networking, and finding new solutions together. That is tentatively set for January 22nd and 23rd in Everett, and you should be hearing more about that in the coming weeks. Just also let us know if you don't already receive our network newsletter. We do send out 2 newsletters. One is to kind of a general population, the other is only to network partners. So just want to make sure that you get all that information when it becomes available. And Cynthia, if I've misquoted anything about that, about the partner proposal process, please correct me, but I think I saw it might open in January.
Yes,
So yeah.
you're right on.
Yeah, yeah. And Cynthia is the connection for that. We'll drop her email in the chat as well if folks have questions about that. So just really encourage you all to be there. And some of you, and maybe all of you, have already been to some of our convenings. They really are well worth your time to just have those moments of connection with others. Our other next step, other than to kind of wrap up these notes and ideas that you've had, is just to start planning for our next meeting in early January, and just making sure that we schedule that at a time that best suits the group that's here and others who may be interested. If there are days and times that work best for you, if you can message us directly here now or email us to let us know. I know for some folks, particular days are clinic days, and they're not available, and we're just hoping to draw from the largest number of folks possible to just begin this work as a community of practice. So please do let us know that as well.
Keiko, I did see Cynthia and Laura had their hands up.
Okay, yeah, go ahead.
Oh, I just wanted to, if I may, put the link to the review committee application in the chat. Our proposal process is actually scored and discussed and recommended by peers. So we have a review committee that will read the applications, and it's a great experience, and I can share with you more about that. I'll put the application in the link, and also I'll put my information. So if you're interested in serving on our review committee, I would love for you to do that. There we go.
And I think my comment builds off Cynthia's, which is just to point out so that it's really clear to folks that this funding proposal process under the Collaborative Action Network is a different process for a different pot of money than what LIN members have applied for and accessed in the past. And that the process that we have been used in previous years for the LIN will not be happening at the end of 2024 here, as it's happened in previous years. Nika and Keiko, please correct me if I'm wrong, but that's my understanding.
That is correct. It's probably those both the how we built out the project proposal process was actually based off of the LIN proposal process. So it's not terribly different. Still really focused on a lot of the same, core things, equity, community voice, impact. So it shouldn't be a shock to the system with how it looks. And we're also, Cynthia is planning on working directly with folks who are interested in applying. Keiko and I will be available if folks are interested in applying to kind of help you walk through the proposal process. The goal really is, to make an impact and to have successful proposals. So it will not be completely different, or you will not be left out on your own. And I think it'll be a really cool opportunity. There's a lot more money that is available than we have had in the past through this process. And there will be a lot more opportunity to really think about collaboration and think about how we're moving beyond, just the traditional oral health providers and being a little more innovative with this process. So I think it is a really good opportunity to expand this work and make a bigger impact on oral health in the region. So yeah, I think I'm excited. I think that there is a lot of opportunity for this group to do some really amazing things. If you feel excited by anything that was put in the Padlet, we'll leave it open for the rest of the day. So if something comes up later that you want to add, feel free to do it. Like Keiko said, we'll pull those notes together and share them out and use that to help have our next meeting be really interactive, where we're building on that. And like I said, we'll be looking for some folks to help lead that work. Melanie? Sorry, I thought I saw you unmute. Yeah, so, and if you're super energized by any of this, feel free to reach out to me or Keiko. Melanie, if you want to stick around, we can show you how to do that. You should be able, just if you're logged in, see the plus sign, and it'll add a little kind of like sticky note, but we can show you too if you're still not able to. Yeah, so if you're energized by any of this, reach out to Keiko or myself. We are happy to connect and kind of start thinking, but really hoping that either in an independent meeting or in a meeting with conjoined with the convening, to have this group in person to really start moving some work forward. Anything to add, Keiko?
No, just thank you all so much for just joining us today, and just for doing the work that you do, and just helping to just shape the nature of oral health and its robust future in our North Sound community. So thanks again for participating today, and for just being thought partners in all that we do.